Today, let's take a look at something very common in the nose, the dorsal hump. So, what exactly is a dorsal hump? The name itself comes from the beak of an eagle because it looks like a beak. If you look at the bridge of the nose, this part here sticks out, and that's what we call a dorsal hump. When people have a dorsal hump, they often think it absolutely has to be removed. That's what people have thought for a long time. The reason is that it can make your features look harsher, and because people believe the bridge of the nose should be as smooth as possible, they've always thought it would be better to get rid of it. But recently the trend has shifted, and people now prefer things that look natural and beautiful. So, considering this current trend, I personally think it's important to communicate with the patient and decide together how much of the dorsal hump should be removed. And these days, we often perform rhinoplasty without implants. Because of that, there seem to be quite a few people who actually want to preserve a bit of the dorsal hump. So while addressing issues like a drooping or bulbous nasal tip, there are many people who prefer to just slightly refine this area or fill in the depressed part here to make it look smoother rather than removing the hump completely. So I think this approach is actually quite good as well. So if you ask whether you absolutely have to remove the nasal hump, these days that's definitely not the case, and I hope you all understand that. In fact, if you try too hard to get rid of the hump, it can actually cause a number of other issues. There are mainly three issues. First, the area where the hump is on the nasal bridge is generally higher than the rest. So the height of the nasal bridge becomes lower. Secondly, when viewed from the front, it can look a bit wider. And third, if you shave down this area too much, this happens in more severe cases, the roof of the nasal bridge can open up, leading to some side effects. This is called an open roof deformity. So, taking these things into consideration, I don't think it's necessary to go overboard in removing the hump.
If you get surgery for a dorsal hump, what about the recovery period? How does it work?
This also depends somewhat on how the surgery is performed. For example, if you just want to address the hump itself, you can do a closed approach, making an incision only inside here, go in, shave down just the hump, and then come out. In this case, the recovery period would be very short. With this method, most of the major swelling subsides in about 3 days. However, the issue with this closed surgery is that its accuracy is a bit lower, so the hump may not be completely resolved or a bit of it might remain. Therefore, the best and most accurate method is definitely the open approach.
Is there any way to address this with a procedure or something less invasive?
There are cases where you can create a beautiful nose without necessarily shaving down the hump. For example, sometimes the area between the eyebrows is low, there's a slight hump, but the tip of the nose doesn't have any major issues. There are these sunken areas. It's also good to fill in these areas a bit with something like a filler. Then the line actually comes out much smoother and more natural than you might think. So in this way, it's actually okay to cover it up to a certain extent. Surgery isn't always the answer. Depending on the case, using fillers can actually look more natural and produce better results. As long as you don't overdo it, you can achieve good results for quite a long time. So I think it would be good to consider filler procedures as well.